Good afternoon and welcome to our webinar hosted jointly with Cedars-Sinai Medical Center. I am Sandeep Bhagat, Chief Investment Officer at Whittier Trust. We are delighted that you have joined us today to discuss a topic that has dominated headlines throughout the year. So even as the coronavirus continues to surge in what is now an ominous second wave, we now have hope in the form of a safe and effective vaccine. The journey so far has been a roller coaster. Is the destination finally in sight now? We look at the ongoing impact of COVID-19 today from two vantage points. We are privileged to have three experts join us today to provide insights from both a healthcare and an economic perspective. So joining Whittier from Cedars-Sinai are Bryan Croft and Art Ochoa. Bryan is Senior Vice President of Operations. Art is Senior Vice President of Advancement and Chief Advancement Officer at Cedars-Sinai. We also have our own Teague Sanders, Senior Vice President and Senior Portfolio Manager at Whittier Trust. Well, let's do this. We first look at the healthcare impact of this phase of the pandemic, and then switch to the economic impact on the consumer. So one quick housekeeping note before I turn it over to Art and Bryan. If you have a question along the way, please type it in the Q&A box in your browser or on your device. We'll try to answer as many of these questions as possible later on. And with that, Art, over to you.
Thank you, Sandeep, and good afternoon, everyone joining today's broadcast. I want to thank my friend and colleague, Bryan Croft in particular. I know he is having an extraordinarily busy day, which comes after an extraordinarily busy multiple of days, given that the surge that we're in the midst of, again, in Southern California. So thank you for joining us today, Bryan. Could you talk for a second about what in your background and your experience and your training has helped you prepare for leading a healthcare organization through a pandemic?
So first of all, thanks a lot, Art, for helping to kind of chaperone me through this. I also want to thank the Whittier Trust and Sandeep for having us as well. Truly an honor to be able to share kind of from an insider's point of view, the perspective. So to answer your question, kind of a little bit about the background. So I think, I'm one of those stories where I've seen it from the front. When I was growing up, my mom said, what are you going to do with your life? And I ended up getting a job as a transporter at a hospital in my hometown. And really, so ultimately, I was able to see from the very, very front of what it is it took to be a part of a hospital, to see patients come and go throughout a hospital. From there, I was promoted to what was called a unit secretary. So you're able to see really kind of the air traffic control job of dealing with physicians' orders and getting patients to and from tests or to and from cath labs or ORs. So that's truly, even to this day, continues to relate to how it is that we're figuring out how to deal with the situation at hand, trying as best we can to appreciate what people might be going through. Having worked multiple shifts where volume just continues to come. And so if anything, I think to ultimately answer your question is an appreciation of what it feels like to be in those roles and be truly on the front where you're helping to either greet patients or care for patients or move patients through what is some of the scariest times of their life. So it's really helped to serve as a great foundation for me to be a part of what's now almost a 30-year career doing this.
And you've got an extraordinary reputation at Cedars-Sinai, period, but certainly for really understanding all of the roles up and down the organization and all of the perspectives that our 15,000 employees have and bring to the job every day. So what one question are you hoping that I'm not going to ask you today?
Oh, well, I'm hoping that you don't ask is how's it going right now? Because it has.
What would the answer to that be?
Yeah, gosh, it's been tough. We made, and I know through the context of the conversation we'll have today, we've made some really, really tough decisions about our surgery and procedure schedules, starting tomorrow. And that's based upon kind of four key metrics that we've looked at, and that's our census, which is basically obviously a census of the patients in the beds that are now. Our COVID census, which continues to grow. Today it's at 192. And that's in the context over the pandemic of being just short of 2,000 patients that we've cared for. Our staffing, which is proving to be the next biggest challenge above and beyond the census right now. That's really, really tough, and how it is that we're dealing with that. And then space, because space becomes a commodity, and how it is that, where it is that we're going to put these patients. And I'm sure you've heard and seen, whether it be in the press or the media of any sort, that we're taking and looking at and alternatively using any space that we possibly can, much of our pre and post-op space. Last night, we had to convert a lobby to a waiting room for our emergency department. So it really is a challenge. So as much as I've told you about it, I just hope you don't ask much more about it.
All right. Well, fair enough. We'll come back to a little bit of that a little bit later, but let's start closer to the beginning of the story and think about in March, the world of this year, the world changed, seemingly overnight as we in healthcare responded to the COVID-19 pandemic. How did your work change?
Well, I think we saw basically a very, very quick pivot to e-everything. And e-everything would include, for where we still needed to do education, we did it via this sort of platform. Where we still needed to care for patients in clinics, we quickly scaled up our ability to have e-visits and to have a platform that was above and beyond, just a basic FaceTime, but that had the ability to give patients, access to their images or to their medical records, and having physicians having meaningful dialogue and conversations. Obviously, you can only go so far. If there's needs to be an exam, that's a challenge. But even that, we've figured out unique ways in which to take pictures and figure out how we can continue to provide the level of care. I think the other thing that we quickly saw, and I've got a whole stack of them because this is what I'm dealing with every single day, is that masks are a part of our daily kind of, coming and going anywhere and everywhere. And everything that we've done really proves. I've been sitting in this chair for largely about 10 months and coming into a place that's dealt with lots and lots of patient volume, much of which I've described. We think that PPE works, and being able to deal in an environment and go into a unit where the entire 24-bed unit is full of COVID positive patients with simply a mask on. It shows what, in the old days, 75 cents a mask could do for you. And over the course of the pandemic, we've seen that go to anywhere from $10 to $12 a mask just because of the nature of the market. So it's been an interesting thing, but, we were able to do it quickly and at scale. And I think I've been, I'll be very honest in saying we've been quite proud of how it is that we've been able to respond.
Well, there's a lot to be proud of for sure. And, you were talking just a second ago about PPE and, how the market went crazy in terms of pricing and supply availability related to PPE. My recollection is during those early days of our response to the pandemic back in March and April, in addition to, you sort of had two full-time jobs, in addition to your normal role running operations for us, you were sort of our PPE acquisition, team leader. What was it like trying to source PPE in a crazy overheated market back in the spring?
Well, I think if I could just answer it in one word, it was tough. I mean, it was really, really challenging because many of our traditional suppliers and or distributors and or manufacturers were in large part equally hit by this because much of their manufacturing was done in China. And so the ability to get product off the production line, but then out of country and then out of country to a place that mattered, our hospitals, our wards, especially when there were so many people across the country competing for it. We saw so many new entrants. Never before had been in this space before, but I think in any good situation, there's opportunists that see opportunities to help for sure. We want to believe in the true kind of altruism that still exists out there. But we also saw people that, felt like they could make money. I think we also saw what I would describe as a very sketchy element, a pretty ugly underbelly of things that went wrong where, orders, we, knock on wood, didn't have a lot of these situations, but we were close on many occasions to, inking deals that were well above what was market price, but because of the nature of needing it, we had to deal with it. There was a fair amount of what I would characterize as some international diplomacy. We dealt with a lot of embassies. We competed against not only a lot of cities or a lot of hospitals, but a lot of states and a lot of countries. We lost one of our big orders to, I think, Morocco. It was, as I recall. And we were willing to spend a lot of money. And so that was challenging, because what we wanted to do is make sure that from a due diligence point of view, that when we would ink these deals, that we weren't getting into something that was not going to yield for us. And so the amount of investment and time and resource and expertise that we had to look for elsewhere outside the institution to be able to source these new entrants, to see truly how altruistic they were or able they were, was really incredibly challenging. But knock on wood, we never had the sort of stockouts that we know that other places across the country experience. And we were, I think, both lucky and really persistent on how it is we approach PPE.
And on top of that, we had people in the community who were coming forward with, donations, large and small, offering to help manufacture things like face shields and the like. And how able were you to fold that effort into the broader effort?
Oh, it was an incredible effort. And I know that Art, but maybe those on the webcast don't know that Art's team was unbelievable in helping us to do this, because the offers of generosity and assistance were incredible and in large part overwhelming. So we had alcohol companies that pivoted their entire operations to make hand sanitizer. We had costume designers helping to make PPE that were masks and gowns and face shields. We also had our accelerator take their entire 3D printing operation and helping to manufacture face shields that are part of our gear to help protect those that are caring for the most acute COVID population. So it was incredible, the outpouring of support, and arguably the level of success we got from that support really helped make our way through it. And even though hand sanitizer may have come in what was once fashioned to be a tequila bottle, it still formed the function that we needed. And it was an incredible way to see how a community came together and really helped us help ourselves.
So what was it like? One of the things that we did at Cedars-Sinai, like a lot of business organizations and workplaces, we sent as many people home at the beginning of the pandemic as possible to work remotely. There were, that said, given the nature of our work, there were the majority of our 15,000 employees couldn't work remotely, couldn't work from home, and they were in the building. I mostly worked remotely during that time. Bryan's been in, I think, virtually every day since the pandemic began. And so you've got a real deep perspective on what it was like in those early days and how you compare it to now. But I'm curious, we can talk about that in a second, but I'm curious, what lessons, if we think about this pandemic is coming in a couple of chapters, and the spring being the early chapter and the summer being the second chapter, and where we are right now, and this fall surge being the third chapter, what were the lessons learned from chapter one, from the spring, and how did you carry those lessons into the work of the summer and now?
Well, I think, first and foremost, and I've alluded to this already, that PPE works. And again, a 25-cent mask has been really my only barrier between me and what's out there for 10 months. And even though I have a stack of them, and I've got an even larger stack here under my desk, it truly does work. And I think that if there's a lesson that we've learned and that hopefully people will learn with us, and I think, given what we've been dealing with as a world for the last 10 months, people have, the PPE does absolutely work. The other thing, and I'm sure I'm talking to those who own businesses as well, and it almost flies counter to what you would think, is that when you're dealing with inventory management, you want to do as best you can to get as real time as possible. And so you want to have as little on the shelf in dealing with potential of of having too much or obsolescence or spoilage or whatever the case may be. I think what we've learned here is that stockpiling is an absolute necessity. And, even though the states have had, caches and the national stockpile has been what it has, I think we've all seen that when we're dealing with the kind of situation at the scale that we're seeing it, that those quickly run out. So we've really learned that we've overbought and we've spot bought, and we've done all kinds of things that were completely incongruent with what would be traditional inventory management techniques that have helped serve us well and continue to keep us well stocked. And then I think the other piece of it is, as much as I want to believe in the good of governments, whether they be at the federal level or the state level or the local level, and they've done incredible things to help us get through this and navigate this. It's been tough for places like us to rely on them for actual delivery of certain products, whether they be ventilators or PPE or any of the other things that have been a part of it. And it's not because they haven't wanted to, but because they've had to do things at scale and at pace that were sometimes really, really challenging. Plus, there were so many other priorities that they had to deal with. And so in many cases, we've had to do what we've had to do on our own. And surely we've had our government relations folks really cued in to what's going on. So it's not that we haven't relied on them, because we have. But to rely on them has been challenging. And so we've learned things that, we just need to be ready and prepared to do on our own should the situation call for it.
And I want to come back to that question about stockpiling in a second. But so as we headed into the summer, your work again pivoted from what you were doing earlier in the pandemic and in the spring. I think you were able to not spend all your time on the phone trying to source PPE from around the world. How did that work change, and what did you do to prepare for what you thought was going to come next?
Yeah, so I think what we tried to do is we tried to appreciate, what was working for us, whether it be care protocols or the PPE that I've described, how it is that distance learning or distance working or telecommuting, we assumed that as part of new normal. And so as we did that, we tried to say this is what normal is going to feel like for a good long while. And so we tried as best we could to try to get back to normal. And many of our metrics, whether they be volume or visits or admissions or whatever, we always measured them against our pre-COVID values. So somewhere in February, how close are we to pre-COVID? And, we tried to have that become part of our daily operations conversations. And what is it that we could do to not only continue to make our place safe for not only our employees, but our physicians, our visitors, our patients, but for also those patients that are absolutely still fearful about coming in. And one of the phenomena that we've seen is that our Medicare population, largely those greater than 65, our Medicare payer mix has shifted. And so we know that there are still people out there that need certain things done. And whether it's hips or knees or backs or eyes or shoulders or hearts or you name it, whatever, we know that there are certain patient populations that are still out there that this new normal is still not palatable. And my parents are in that same category. They just, as best they can, minimize what they do. But we've tried to pivot back to normal, recognizing that normal won't look the way it did when we first started this.
And over the summer, those numbers really did come back. I mean, our volume really did come back, and yet now we're in the fall surge that many people predicted would be coming. And we talked a little while ago about some aspects of how it's different from the spring, but could you spend another second on talking about how it's similar and how it is different from what we experienced in the spring? Because it feels different to me.
Yeah, so it absolutely is different. And just to give you some context here, so we are, an 890-bed hospital that 2 weeks ago our census was 966. We had at that time a COVID population that over the course of the last 8 months was around 35, 40. It would peak to 50 and then go back down. But those numbers really have accelerated. And so pace has been an incredible thing to have to deal with. So as we sit here today, our COVID inpatient population is at 192. and our projections are that numbers continue to go up. The volume of those patients and that pace have been really, really challenging. So as I shared before, our emergency department is becoming more and more overwhelmed and dealing now also with the challenges of the earlier part of the pandemic, of social distancing continuing to be a challenge, so space being a commodity. And so we've had patients not only cared for in our tent, but waiting in our tent, and waiting on our stoop right outside the emergency department, because social distancing is a true, tried and true mechanism to make sure that we don't perpetuate the spread. And so we really have been challenged with space. We've seen an age difference from the first time. The initial phase was a more senior population, but as most of those folks have continued to isolate and to not be as mobile or visible or out and about as they once were, is again changed the presentation of patients today. And then, as I said before, we on this campus alone are close to having seen inpatients close to 2,000 COVID patients. And then on top of that, probably another 1,500 or so that have been seen and discharged out of our emergency department. So the volumes are noticeable, and pace and volume do seem to be the really differentiator as for this phase versus the first.
And it seems to me that, if the first phase was also characterized by a scramble for PPE, which we're not in the midst of right now, as well as a really emptying of not only our hospital but all hospitals around the country to prepare for a surge in the spring. Now we've got PPE on hand, and we're lucky in that regard. But the other thing is, I think as you described it, we've tried to stay open for as many other kinds of cases as possible. And with better AI and better analytics, we're really able to try to manage those two sets of populations simultaneously. The big challenge that we've got now, as you described it, that we didn't have in the spring necessarily, is on the personnel side. And you've got a lot of people who are working hard, who are burned out, and you've got wider community spread as well. And so just like there is a risk to all of us if we're out and about, there's a risk to staff as well.
And I would add just one additional point, because it was a big part of how it is that we responded the first time around that is absolutely different. Is that in the past we've been able, in healthcare, we use a term called travelers, but basically nurses or respiratory therapists or other sorts of needed occupations in a hospital. There's a big travel population. And in the past, in particular on nursing front, we were able to get travelers from all over the country because they weren't surging and they were able and willing and wanted to come west. That's just not been the case here, and we've not been able to get them. And where we have been able to get them, we're paying 3 and 4x of what it is that we would have paid early on. And it kind of marries some of the PPE phenomena and basic economics of supply and demand. It really, truly has been a challenge for us.
Sure. So if this is chapter 3, there's definitely going to be at least a chapter 4. So what lies ahead in the pandemic from your perspective? How's the winter going to look? And how about next year?
Well, so I think if you believe everything you're seeing and reading from the health officials, it's going to be a really, really tough next 60 to 90 days. And we may argue next 90 to 120 days, because we think that, we're still dealing with what we think to be the Thanksgiving bump. We think that we're going to continue to have to manage through and probably manage into a Christmas and Hanukkah and New Year's bump that are no doubt on the cusp here. And so we think that we're going to be incredibly challenged to continue to deal with just the volumes. And so we're going to continue, as you described, to do the things that we have to do. Those patients who present with urgent and emergent needs, those needs of neuro cases or cardiac cases or absolutely cancer cases. But we're going to have to do that in the context of what is a very, very full house that are full of patients that are either COVID confirmed or suspect, which has really been tapping resources, both space and staff. And so, I think we're going to be really continued to be really challenged as it relates to what we're seeing now, and maybe even more so, and be more challenged coming forward. I hate to be pessimistic, but I'm also a realist.
Well, let's talk about a bright spot, as Sandeep outlined at the beginning of today's webcast, and that's the vaccine. And can you tell us a little bit about Cedars-Sinai's plans related to the vaccine distribution?
I can. So I think great news. So it happens to be a great timing for this webinar. Is that, at 6 o'clock this morning, I met a delivery truck, I think fresh from LAX, on our dock. And we received our first allocation of the Pfizer COVID-19 vaccine. So we received at this point, and this will be the first of many, 3,700 doses. We'll begin our first inoculations of our triaged patient-facing healthcare workers on Thursday. The desire is to have anywhere from 400 to 500 of those doses delivered per day. And then at least at this point that we're planning to do the vaccines 5 days a week. But, given what we think will be the demand and what will be the supply, which will be a good problem to have, that we'll do as best we can to scale quickly to 7 days a week.
So are you and your family going to get the vaccine? We
are. We absolutely are. I think, given, all the smart people that we're surrounded with every day here, their understanding of the science, their understanding of how trials work, even in this case, in an accelerated fashion, and the fact that there are things that can get to market so much more quickly than perhaps one that would have been a more traditional trials path where it's years in the making. There are people here that are incredibly smart, that are leading, programs that know this science, that understand what the mRNA approach to vaccines is all about. And they are absolutely, and they want to be viewed as very pro this, because we think that this would be viewed as the start to what's described as herd immunity, but also really a show of what it is that we in healthcare need to do to help protect the public's health just the same.
And which vaccine are you going to take?
So the ones we have now is Pfizer. We know that a couple of days ago, Moderna was approved, and the fact that it doesn't require the -80, may have a different sort of distribution. But I will say that given the efficacy that we've seen in both via the trials that are out, I really don't care. I would take either, but I am going to, wait my turn just per, the protocols and what CDC has given as guidance for us, and we'll absolutely be there in line for whatever position that we hold.
So, how do you think? I know we're coming to the end of our time here, and I'm curious. How do you think healthcare is going to be different post-pandemic, and how's your work going to be different, and how's Cedars-Sinai going to be different post-pandemic? I know that's a big question, but.
Yeah, well, so I think there's been a lot of things we've learned. I've described several of them on the supply chain front, so I won't revisit that. I do think that, we have been able to prove that we're as a big place with 15,000 employees, we're pretty malleable, we're pretty flexible, we're pretty agile when we have to be. We do think that we found a lot of takers and a lot of actual satisfaction, actually, in the efficacy of e-visits. And for some of the programs that we have where the reach needs to be far and wide, that makes so much more sense for patients to be able to access us differently. So we absolutely think that e-visits and e-post-op visits and e-wound checks will be a part of our future here. And just being able to understand kind of what we need to continue to do as a basic hospital, and that's to be available for patients who need us in emergency departments, in cath labs and ORs, and figuring out how we can effectively, even though the approaches will be different and the people doing it may be different, is that we've got to figure out how to continue to be available for those who most need us for life and limb issues, and for those issues that, if not done now, will truly affect and in many cases harm the outcomes associated with whatever they're dealing with. So, I do think that we've learned a lot from this, and these will be lessons learned that will be another brick in what we think is a strong foundation for what we're doing for this community and what we'll do for years to come.
So my last question, what one question should I have asked you, but I didn't?
Well, so I'm hopeful I would that you would have asked is how the audience might be able to help. And I would hope that you would continue to think about people in healthcare, and whether they're people that you know or people in your family or those that might be affected or need healthcare. Just continue to think about us, because we've been kind of in the front of the media cycle for a good long time, and I know that the world seems to be tired of dealing with COVID, but there's a lot of people that are really doing some unbelievable things upstairs, literally as we speak. If you pray, we'll take prayers. That's a big deal, of course, as well. Understand that masks and hand washing and distancing, all the traditional public health things that are very much a part of this entire response, are continuing to be an important part, even after a vaccine, because we think that will be an important part of helping to maintain. And then just an appreciation of the situation being as fluid as it is. And I know that there's been lots of changing messages, whether they be from governments or from hospitals or from public health officials, but appreciate the fact that it's such a fluid situation, that, facts change. And as best we can, we're doing everything we can to not only communicate them, but to communicate them at scale. And that's the thing that, we've learned a little bit better about how to do it, but we're never going to be perfect. But the ideal is that we aspire to be perfect, and that we're trying to do it in a situation that is incredibly fluid. So just appreciation of kind of the situation that we're all living in, some of us in a different way.
Well, thanks, Bryan. Thank you for taking the time today to share your perspective and your experience and what it's like to be at Cedars-Sinai and be leading our teams right now on the operations front. So I think we're at the end of our time here for this part of the webcast, and I think I'm supposed to turn it back to Sandeep.
Thank you.
The proverbial mute button. Teague, I'll quickly turn it over to you and make sure we have a smooth transition.
Thanks, Sandeep, and thanks, Bryan. I mean, that's such great news on the vaccine front, and I wholeheartedly agree with you. If you let me be first in line, I'd be right there. So one of the questions we get a lot about is, in this pandemic, how is it impacting the overall economy? And so one of the things we thought we'd kind of talk about and walk through is, with the consumer spending being 60 to 70% of GDP in the United States, how is the consumer being impacted, and how is the labor market being impacted? And I wanted to walk through this in kind of 4 ways. So I want to touch on, first, what has been impacted by the labor market. Second, the savings rate, and what have we seen in the savings rate that gives us some ability to get a little bit bullish on the consumer. Third is spending patterns, and how are these different versus the last recession that we saw. And then finally, what has been pulled forward? What has actually happened to the consumer? What trends have been pulled forward in this pandemic versus the last recession? And so let's just start with the labor market. So obviously, job losses were truly staggering in the United States. Americans lost approximately 22 million jobs at the peak of the pandemic, and unemployment touched 14.7%. I mean, these are levels that just dwarf everything in the historical context of the labor market. But however, we have seen some labor markets recover, and in recent months, we've actually seen the labor market add back about 12 million of those lost jobs. So there is some light at the end of the tunnel, as it were, with the labor market. But underneath all of that, there's definitely disparity between industries and income. So if you look at high wage earners, right, those making $60,000 a year or more, that cohort essentially fully recovered by the end of the summer. But low wage earners, right, those making less than $27,000 a year, those are still seeing job losses 20% below where they were in their June averages. And additionally, as you might expect, different industries and sectors were wildly impacted differently. So if you go back to February, hotels are still 35% below their peak. Fitness centers are 32% below their peak. And at the nadir, hairdressers, lost 81% of their jobs, and restaurants were down 67%. Now, contrast this with home improvement centers and delivery services, which have actually seen growth of 14% and 11% respectively. But if you look at the most recent jobs report, it was sort of a Goldilocks miss, right? Employers added 245,000 jobs, which was below expectations for November and down from the 610,000 jobs added in October. And while it did knock unemployment down slightly to 6.7% from 6.9%, it was actually partially due to the fact that labor force participation came down to 61.5%. And these are levels we haven't seen since the 1970s. So even though you saw unemployment ratcheting down, which is definitely a good thing, it was a large chunk due to the fact that people were just leaving the labor force entirely or were no longer looking for work. So why is this Goldilocks? Well, not too hot in that you worry about interest rates rising or inflation being a concern, but not so bad that you're worried about the most catastrophic and downside impact of this negative jobs report, meaning that stimulus is definitely on the table, right? And so that will definitely, we're expecting it to come in the next week or two, and it looks to be a pretty significant package. So the labor market is recovering, is still fragile, but there's definitely room for it to get better, but it has definitely recovered from the peak of the worst of the pandemic. Second point is about savings rate and its implication for demand. So with the Federal Reserve injecting trillions of dollars into the economy, there was a phenomenon where personal savings rates actually skyrocketed to levels we've never seen in the United States. Personal savings rates actually touched 33.7% in April. And there's an economic theory called the paradox of thrift, right? And what this says is that as savings rates increase, there's a potential for it actually to be bad for the overall economy because the velocity of money kind of slows down in the economy. You're not out there spending it, you're saving it. And so this paradox is that the healthier the consumer is and starting to save, the worse it could actually be for the overall economy. However, in this instance, given what we saw in the labor market, the way it's recovered, this paradox does not look to be holding true. And why is this? Well, it's because the recovery in wages and salaries that the fiscal stimulus brought on could be so much more impactful because the consumer was so much healthier. So for example, if you go back to last recession prior to 2005, 2006, savings rates were essentially zero after inflation. So a lot of the stimulus that was injected into the economy post that number actually went back in to just kind of boosting overall savings rates. Contrast that with today, where so much of the stimulus was saved because by and large, consumer balance sheets were a lot healthier coming into the recession. And if you can look at that and look at what happened to income, you can understand why we begin to see that there might be some pent-up demand in the labor, in the consumer. In fact, we've already seen consumer sentiment come in at 81.4, meaning that even as parts of the economy are actually shutting down, consumers are more optimistic about their overall futures. And so this, again, just kind of portends the fact that savings are increasing, so are incomes, so there might be some pent-up demand. The third point I want to touch on briefly is just spending patterns, and they're very different versus the last recession. Again, if you go back to 2005, savings rates were essentially negative. And what we saw then, too, is that credit card utilization was actually much higher than it is today. Credit card utilization rates back then were about 28%, versus today, those are ticking much closer to 21%. So we haven't seen levels this low in 1 to 2 decades. And so that's really, again, looks at the health of the balance sheet of the consumer and the way that they're spending. So consumers have higher savings, lower credit card balance, and because of transfer payments and stimulus, a lot of them also have higher incomes overall, again, providing evidence why we might see demand rebound strongly at the end of 20 and into 2021. And again, it's worth noting that in the next week or two, we expect to see an additional $908 billion in stimulus potentially be injected into the economy. So again, definitely a positive. And so what are people buying, right? With all this savings and all this potential spending, what are they doing with this actual money? Well, coming into the pandemic, we saw a real trend, right? We call this experience versus things. And so prior to the pandemic, people were really spending a lot more on the experiences, right? Going out to eat, going on vacation, traveling. And with the pandemic and the forced savings, this pendulum has shifted a lot further back towards things, right? We have a forced savings rate, and people are now able to utilize this money to go out and buy one of the largest purchases that most of them ever buy, which is their home. Prior to the pandemic, home affordability was really difficult. And again, it's about not necessarily your debt to income, but it's always about the down payment. And so this forced spending, this forced saving has allowed a lot of people to kind of go back and be able to look at their personal space. And so we're seeing a bit of a reversal in that people are putting a little bit more weight on the things in their life rather than just the experiences, because they can't really go out anyway. And so finally, the fourth thing, what has it done to spending patterns and what's been pulled forward? And so what we've seen is a lot of trends be pulled forward. And we've seen from the consumer standpoint, like I said, home prices have really skyrocketed. If you look at year-over-year home growth in October in 2020, it was 15% above last year. And remember, the most difficult thing is the down payment. And so with people forced to save, they can actually go out and get those down payments finally. And anecdotally, we're seeing strength in the suburbs and not the city. And we're also seeing strength in second home purchases as families, again, move out of that urban environment into a suburban environment where they can really control and have a lot more space. And finally, just as the recovery is not equal for everyone, it's also not equal for all business models. What we are seeing is that trends prior to the pandemic that we thought would take place in 5 to 7 years have been pulled forward into a 6 to 9 month window, a really narrow window. And so if you were a traditional brick and mortar retailer and you were heavily dependent on that consumer coming into your shop, that's really been a difficult situation for you. We have definitely seen a number of those companies actually go bankrupt. If you look at Brooks Brothers, Lord & Taylor's, JCPenney's, I mean, they've all had a really, really rough go of it. But if you look at other business models, they've actually been able to benefit, which is a difficult term, from this overall pandemic. And so some of those companies, Amazon, right? So we all eventually knew Amazon was going to control all of retail. We just didn't know it was going to happen as fast as it did. And this trend definitely got accelerated. On top of that, Amazon Web Services, so all of these web hosting, all of these browsers, everyone working from home, that's definitely benefited Amazon Web Services. They've kind of had a two-prong benefit approach there. Another company is Nike, right? So 5 to 7 years ago, Nike began their platform transition. Traditionally been a wholesaler. They relied very heavily on brick and mortar. They relied very heavily on the Foot Lockers of the world. And back then they transitioned more towards a direct-to-consumer model. And that DTC, direct-to-consumer model, has really benefited as we're all sitting at home. We need to go for a walk, hey, I'll go for a run. And so Nike's platform and that decision has definitely benefited from this global pandemic. And finally, Zoom, right? So the equity in Zoom is now worth more than Ford and GM combined. And just think about what that means. 18 months ago, none of us had ever heard of Zoom. And now to some of us, it's a 4-letter word. And so the growth and the exponential growth so quickly in a business model like that is really kind of indicative of what we're seeing. And that we all knew that you could eventually commute and there would be this kind of balance of some in the office, some out of the office, but Zoom just really kind of benefited and pulled forward that entire demand into really a 9-month window that we just didn't see coming into the overall pandemic. So Steve, just to reiterate, what are we seeing out there? One, the labor market, right? The labor market has definitely recovered. It's still fragile and it's still definitely uneven. Number two, forced savings has really meant that there is some pent-up demand for the consumer. And albeit, experience versus things is going to shift back. People are eventually going to go eat. They're eventually going to go out to a restaurant. They're eventually going to get on a cruise ship. Might not be at the 2019 levels, but that demand will definitely come back because we all want to go out and see the world again. Three, spending patterns have definitely shifted. We are definitely looking at a healthier balance sheet. We are definitely looking at the fact that credit card balance are not as difficult and they're not as impactful for the consumer, so much healthier consumer. And finally, demand has been pulled forward, right? We've definitely seen demand pulled forward for housing. We've seen business models transition and that demand be pulled forward. And so while we think the consumer is still fragile and in recovery stage, we're definitely positive that there will be some demand pent up that could be delivered on the backside of this as we're saving and seeing increased incomes as well. So Sandeep, with that, I'll transfer it back to you if we have any questions.
We do indeed. Thanks, Teague. We have a number of questions. I see we have 15 minutes. I'm going to try and pack as much into it as possible. The first question is directed to Bryan. Bryan, what are your thoughts on whether the government will make these vaccinations mandatory? If they do, what might be the verification process for vaccinations?
So good question. So at least at this point, either me personally, I haven't been in the right meetings to hear that as a possibility, or it has not yet kind of made its way to, kind of what it is that they're aspiring to do with the vaccinations. That said, we are not within our four walls making the vaccine mandatory for any of our employees who may qualify for it. We are appreciating it for what it is as it relates to a new vaccine, and the fact that many people have their either own preconceived notions about vaccines, and or they want to wait till the science becomes a bit more solid, and or trials become a bit more obvious as it relates to what potential outcomes may be, and or long-term outcomes. That said, I can tell you, and again, it's not your question, but I'll answer it with another one, is the fact that the flu on our campus has, over the course of the last couple of years, the flu vaccine has been made mandatory. And so will the COVID-19 vaccine become that route next? I think it's time to tell, but we have not been made aware of any sort of government actions or any sort of potentials to move the direction of mandatory.
Well, that's because we have two presidents in the White House. Maybe that's why. For either one of you, a really simple, quick question. Which other hospitals in Los Angeles, you talked about your 3,700 doses, which other hospitals locally have been slated to receive the Pfizer vaccine?
Bryan's closer to that. You may have the list handy.
Yeah, so we were viewed as one of the main, in the way they're doing this, we were viewed as one of the main distributors. So we're distributing to a number of hospitals that are in our proximal to our location here. It's my understanding that there would be, within the next round, which I believe is described as next week, others within the city that would be able to do that. I have heard, and again, I've only seen it on the local news, so to take that for what it's worth, is that, the Kaiser facilities that are here local have also received a distribution. But at this point, and given the fact that they're trying to scale a distribution process that's 50 states wide, is that they are slowly going about how it is they're doing it. And my bet is it will continue to scale from there. But it's not many, but my bet is it will be exponential over the course of days and weeks.
And obviously, a lot of what's driving that is the ability to store at ultra cold temperatures, and which we have that ability, and there are a number of other institutions in the region, but that's a rate limiting factor here.
Are either of you at liberty to describe Cedars-Sinai's financial resilience throughout the pandemic?
I think generically I can make a comment. I think we have, knock on wood, fared better than many. We had an incredible, thoughtful board that was incredible in their support of the organization, and we have a CEO who has been here for 40 plus years with a senior team that has got similar experiences, and I think the decisions of the past that have helped build a very, very strong foundation have helped us navigate this. And so that said, we were able to basically keep, even when there wasn't work to be had, when we had to make the tough decision for 2 months to shutter our surgery and procedure business, to do a pay protection plan where everyone maintained a full paycheck. And so we were able to maintain that. And as things, as I described, came back and we were feeling more and more comfortable with being able to have kind of a foot in both boats there, we were able to get those volumes to, in many cases, north of 100% of our pre-COVID volumes. And so we've been able to scale back quite quickly, and we're on tap to fare quite well. Now, this will have thrown us now another curveball, but we'll continue to do the smart things that hospitals and businesses do, and that's watch management and FTEs and watch and do all the kind of things we can do from a fiscal point of view. But we've actually fared better than most, but not meeting budgets as you might expect, but doing better than what we had hoped.
On a note of prudent caution, the good news is we have not one but two vaccines. We spoke to both, Pfizer and Moderna. They're, however, both based on the same revolutionary mRNA technique. So let's just think for a moment, if for some reason, against all odds, this is not the base case, but if something were to go wrong with this mRNA vaccines, is there a plan B? And specifically, How far along are the Johnson & Johnson and AstraZeneca vaccines? How are they different? Are they viable?
Well, so you're talking to a tax lawyer by training in me, and a hospital and healthcare management executive in Bryan. Neither of us being scientists by training, nor virologists nor immunologists. And I'll let Bryan's been a little bit closer to this, so I'll let him answer maybe more fulsomely in a second. I will say that my understanding is that, you know, the J&J vaccine, which has two very interesting features associated with it. One is it's a single dose, and two, it doesn't require, you know, cold storage, which has all kinds of promise for a wider distribution domestically and internationally. And AstraZeneca vaccine both had a little bit of setbacks with regard to their trials. My understanding is those have been delayed, but both of those vaccines do look promising. At least one of them, I think, uses a different technology. But beyond that, I would be certainly out of my depth. Ask me a tax question, but beyond that, I'd be out of my depth. Bryan, I don't know what you would add.
Yeah, not much more. I think we've been so focused on kind of the here and now and dealing with what we've known to be the Moderna and the Pfizer developments, and now distribution, and then ultimately execution and injection. So, you know, we haven't, Art and I haven't for sure been focused on that. But, you know, I'm hopeful because we do hear that a number of countries have their own. And so my bet is that there will be a proliferation of similar across the world.
Yeah. And I'll step away from the specifics, but just on a broader theme, on behalf of the entire medical and scientific community at Cedars-Sinai, this has been really impressive in terms of a testament to human ingenuity. No vaccine had been developed in less than 3 years. No mRNA vaccine has ever been deployed. Does this bode well for our treatment of other diseases? Did something novel and momentous happen in these 8 or 9 months that gives us hope for medical innovation going forward?
Bryan, do you want to take the first part of that? I've got a thought that'll add here at the end, maybe.
So, you know, I think, and I'm only trying to be optimistic here, but I do think so. And I think I'll even parallel it with some of the things that we learned kind of from an operational point of view here, is that when you have a bunch of people, and arguably a bunch of smart people, putting their mind to something, and whatever that something is, whether it's the evolution of medical development or vaccine or whatever, in our case, figuring out how to operationalize in the course of a pandemic, either clinics or surgery or whatever, I think it's proof that when you put good minds to something and have a goal of being able to either get there or solve it or create it, that you're seeing some of the yield of that sort of mind power and horsepower to get it done. And, you know, I would say, and I'll, again, be optimistic and hopeful that it will play out, and that lessons learned and how it is that we did things and how it is that the FDA worked and did it at pace and at scale would be things that we'd be able to see, because one of the things that has been a chronic issue is how quickly drug development does happen. And our hope is that, you know, this will be a way in which we'll learn lessons that we could put forward in better forms and fashion moving forward.
I know. And just go ahead. I'm sorry, Sandeep.
No,
I was just going to say I would just observe that, you know, I think all of this worked for all the reasons Bryan identified, and because we devoted a vast amount of resources to solve the problem. And so I think that we just have to be mindful that it's not just smart people working really hard and working creatively and thinking differently and outside of the box about solving problems, because all of that is true. But on top of that, we need to think about, if we're going to solve big health problems, we're going to need to bring vast amount of resources to bear.
I know Teague is feeling a little left out. We have 4.5 minutes. Teague, I'm going to come to you with at least 2 questions. We'll see if we can sneak in a third. So you spoke about the savings rate going up in the midst of all of this fiscal stimulus. Why is it that consumers have not spent that money? And when they do start spending it, what will it be on?
Well, yeah, I think it's a couple-pronged approach going on here. So I spoke about the recovery in the jobs market and the fact that lower wage income earners have not recovered as much as higher wage income earners have. What's ironic is that the inverse is true of spending patterns, right? A larger percentage of lower income earners spend is on staples versus higher income earners that are spent on more luxury items, right? And so what I'm thinking of right away, why haven't we spent that? Well, you can't really spend it on a number of things that are closed. We don't go travel. We're not spending on concerts. We're not going out to do anything, right? So all that's kind of taken back from the higher income earners. So what are we going to start spending money on when we do get out there? And this sounds a little bit trite, but I think we're going to end up spending money on things that make us feel human and normal again. And one of the things I think is really going to be, impactful there is these attainable luxury items. So think about Starbucks. Think about going out and being able to go get a cup of coffee again and be able to talk to your friends and not have to worry about wearing the mask the entire time. Going out to eat, right? I think it's going to be a while before most of us raise their hand to go to a rock concert or a club again. But I do think that those attainable luxury items and eking out, putting your toe in the water, going out to spend again are going to be some of the first things that we spend. I think we're also going to continue spending on durable goods, right? So as home improvement centers have rebounded and continue to be kind of drivers of growth for the U.S. economy here, we're going to be spending on more durable items as well. So think washers, dryers, refrigerators, that kind of thing. So that combination and juxtaposition of attainable luxury and durable goods purchases from the higher wage earner who has yet to be able to go out and didn't really benefit as much from the PPP money as well.
T, you talked about a lot of bankruptcies in traditional brick and mortar retail stores, Brooks Brothers and a bunch of other stores. Will this ever come back? What happens to the face of retail? Is it just e-commerce? Is that the only business model, or are there hybrid business models that still have a hope going forward?
So we talk a lot about this as, you think of a pendulum of experiences and things and how that works out. I think at the end of the day, we're going to end up with brands and distribution. And the groups and business models that can dominate either of those will be the ones that continue to survive and to thrive. And so if you go back to the traditional department store, prior to Amazon, prior to e-commerce, they were the king of distribution, right? The brands have always been very, very valuable, right? Nike's brand isn't going anywhere. Lululemon's brand has gotten stronger and isn't going anywhere. And so the business model, those things will come back because not everything do you want to buy online. I can think of a number of items I want to try on that I'm not necessarily going to buy online. But by and large, they're going to be changing. And so distribution becomes very valuable. Brands have become very valuable. And I think the combination of those, the omni-channel, is essentially where if you can get there, that's the holy grail of retail in the future.
So we're almost at the end of the hour. So I think I'm going to decide to wrap up today's conversation. So I want to thank a number of people. First, Bryan and Art, not just so much for your insightful and lively discussion, which was a pleasure to listen to, but on the most humble and sincere note, on behalf of every person on this call, we would like to extend to you, your colleagues, and everybody on the front line. And we owe you an enormous debt of gratitude. People talked about the problems with isolation, anxiety, insecurity, and depression caused by the pandemic. For the frontline worker, it was more than that. Bryan, you talked about the 25-cent mask, which was way less than 25 millimeters thick, and that was all that kept you away from a fatal viral disease. And for what you have done in the last few months, we will remain eternally grateful to people like you, your colleagues, and everybody on the front line. Teague, thanks for your perspectives on the U.S. consumer. Most of all, thank you to all of you in the audience for tuning in today. As always, please reach out to your Whittier client advisor or portfolio manager if you have any questions. We're always ready to be of any help. And finally, we wish you good health, safety, and joy over the holiday season. Happy holidays.